The ultrasound image shows a perfect 12-week fetus, 10 fingers, 10 toes. A heartbeat flickering on the screen like a tiny strobe light, steady and strong at 155 beats per minute. Sarah Martinez is lying on the examination table, her shirt pulled up to expose her growing belly, watching the monitor with a smile that could light up the entire room. Everything looks perfect, I say, moving the ultrasound wand to get different angles. Baby's measuring right on track. Good cardiac activity. Normal anatomy as far as we can see at this stage. Can you tell the sex yet? Sarah asks, her eyes never leaving the screen. It's still a bit early, but at your 20-week scan, we should be able to tell if you want to know. Her husband Michael sits in the chair beside the examination table, and something about his posture makes me glance over. He's leaning forward, elbows on his knees, staring at the floor instead of the monitor. His face is pale. His jaw is clenched. Michael, do you want to come closer to see? I offer. He doesn't move, doesn't look up, just sits there like a statue, frozen in some private crisis I don't yet understand. Sarah notices too. Honey, don't you want to see the baby? When Michael finally raises his head, his expression stops my heart. It's not joy. It's not excitement. It's something between shock and horror and disbelief. Sarah, he says, his voice barely above a whisper, we need to talk. Can it wait? I'm looking at our baby. I had a vasectomy. The words fall into the room like stones into still water, creating ripples that spread outward and change everything. Sarah's smile falters. What? 5 years ago? I had a vasectomy 5 years ago. The silence that follows is crushing. I freeze with the ultrasound wand still pressed against Sarah's belly, the baby's heartbeat continuing its steady rhythm on the monitor, oblivious to the bomb that's just detonated in this small examination room. Sarah turns to look at her husband, her face transforming from joy to confusion to something that might be the beginning of understanding. That's not possible. You never told me. I never told you because I thought we were done having kids after Emma was born. You were struggling with postpartum depression. We agreed we didn't want more children. I got the procedure and never mentioned it because... He trails off, unable or unwilling to finish. Because what, Michael? Because if you're pregnant, and I've been sterile for 5 years, then the baby isn't mine. I'm standing here holding an ultrasound wand, looking at a perfectly healthy 12-week fetus, while a marriage potentially disintegrates in real time in front of me. This is my 6th month as an internal medicine resident at Hospital St. Halsted, and nothing in my training prepared me for this moment. Not the textbooks about prenatal care, not the lectures about delivering difficult news, not even the ethics courses about patient confidentiality and family dynamics, because what I'm witnessing isn't a medical crisis. It's a human one, and what happens in the next few minutes will teach me more about truth, trust, and the devastating complexity of relationships than anything I learned in 4 years of medical school. My name is Dr. Noah Reyes, and I'm 27 years old, which means I'm young enough that pregnant patients sometimes ask if I'm old enough to be a doctor, and experienced enough now to know how to handle that question with grace instead of defensiveness. I'm a first-year internal medicine resident at St. Halsted Hospital in a mid-sized American city where November has arrived with cold rain and early darkness. The hospital was built in 1924, all red brick and tall windows, with modern additions that never quite match the original architecture. I grew up in Houston, Texas, the son of Mexican immigrants who sacrificed everything so I could become the first person in our family to graduate from college, let alone medical school. My mother cleaned houses until her hands were raw and her knees gave out. My father drove trucks across the country, sometimes gone for weeks at a time, his back permanently damaged from years of loading and unloading. When I got my acceptance to medical school, my mother cried for 3 days straight and lit candles at church every morning. My father just gripped my shoulders and said in Spanish, "Ahora llevas nuestra esperanza contigo." Now you carry our hope with you. So every patient I see carries that weight. Every decision I make echoes with their sacrifices, their dreams, their unspoken expectation that I'll be worthy of everything they gave up. The thing they don't tell you in medical school, or maybe they tell you but you don't really understand until you're living it, is how much of medicine happens in the spaces between diagnosis and treatment. The human moments, the complicated family dynamics, the secrets people keep, the lies that unravel, the truths that destroy. I'm technically an internal medicine resident, but St. Halsted is a smaller hospital where we rotate through different services to get broader training. This month I've been covering some obstetrics overflow, seeing pregnant patients for routine prenatal visits when the OB clinic is overbooked, handling straightforward cases under the supervision of the attending physicians. My attending this month is Dr. Lisa Huang, a 45-year-old physician with 20 years of experience in both internal medicine and obstetrics. She has this way of seeing past the medical facts to the human stories underneath. Last week, she'd pulled me aside after I presented a case. "Noah, you gave me all the clinical details, blood pressure, fundal height, fetal heart rate, but you didn't tell me anything about the patient as a person. Is she scared? Excited? Does she have support at home? Is this a wanted pregnancy? Those things matter just as much as the medical facts. I thought we were supposed to focus on objective clinical data. We are, but patients aren't collections of data points. They're people living complex lives. Understanding their context helps us provide better care. Always ask yourself, what's the story behind the story?" I'd thought about that conversation a lot over the past week, trying to see my patients more completely. But I never imagined I'd encounter a story quite like this one. Sarah Martinez is 32 years old, Gravida 2 Para 1, which means this is her second pregnancy and she has one living child. She came to my clinic 4 weeks ago for her initial prenatal visit after her home pregnancy test came back positive. I'd reviewed her history, done a physical exam, ordered labs, and scheduled her for today's first trimester ultrasound. She'd seemed happy at that visit, nervous but excited. She'd mentioned that she and her husband Michael had been trying to conceive for almost 2 years, that they'd started to worry something might be wrong, and that this pregnancy felt like a miracle after so much disappointment. We'd almost given up, she'd told me during that first visit, her eyes bright with hope. Every month was this roller coaster of hope and disappointment. I'd take a pregnancy test, see it was negative, and just feel crushed all over again. Michael kept telling me to be patient, that it would happen when the time was right. And I guess he was right. Michael had been with her at that first visit too, sitting quietly in the corner while I examined his wife and discussed prenatal vitamins, nutrition, what to expect in the coming months. He'd seemed supportive but subdued. I'd attributed it to typical nervous father energy. Some men get quiet and withdrawn when faced with the reality of impending parenthood, especially after struggling with infertility. I hadn't imagined he was sitting there knowing that if his wife was pregnant, she must have been unfaithful. Looking back now, I can see signs I missed. The way he'd avoided looking at Sarah directly, the tension in his shoulders, the way his hands gripped the arms of the chair like he was trying to anchor himself. But at the time, I'd interpreted those signs as anxiety about the pregnancy itself, not as internal conflict about a secret he'd been carrying for 5 years. Now I'm standing in this examination room, ultrasound wand in hand, watching their marriage potentially implode while a baby's heartbeat continues its steady rhythm in the background. I say carefully, my voice cutting through the terrible silence, that maybe I should step out and give you both some privacy to talk. No. Michael stands abruptly, the chair scraping loudly against the linoleum floor. "I can't be in here. I can't look at that screen. I can't..." His voice breaks. "Sarah, I need to know. I need to understand what happened." Sarah is crying now, tears streaming down her face, but her expression is confusion more than guilt. "Michael, I don't understand. You had a vasectomy? When? Why didn't you tell me?" 5 years ago, right after Emma was born. You were having such a hard time with the postpartum depression, and we talked about how overwhelmed you felt, how you said you couldn't imagine going through pregnancy and infancy again. So I scheduled the procedure and got it done. I thought I was doing the right thing, making sure we wouldn't have any accidents, taking the burden of birth control off you. But I never agreed to that. We talked about not wanting more kids at that moment, but that was when I was in the worst of the depression. Once I got treatment, once I felt better, I started thinking maybe we could have another baby someday. And you never told me you'd made it permanent. The pain in her voice is raw, visceral. I can see her processing not just the immediate accusation, but the deeper betrayal. 5 years of marriage where her husband kept a significant secret from her, made a unilateral decision about their reproductive future without her knowledge or consent. Because I thought... Michael runs his hands through his hair, agitated. "I thought if you wanted more kids later, we could talk about it. Vasectomies can sometimes be reversed. But Sarah, you're pregnant now, and I'm sterile. So how..." He can't finish the question. The accusation hangs in the air unspoken but obvious. Sarah's face transforms from confusion to comprehension to fury. "You think I cheated on you? You think I..." She sits up abruptly, wiping ultrasound gel off her belly with shaking hands. "Get out. Get out of this room right now. Sarah, get out!" Michael leaves, the door slamming behind him hard enough to rattle the diplomas on the wall. The sound echoes in the small room, and I'm left standing there with my patient who's sobbing uncontrollably, her hand pressed against her belly as if to shield the baby from the emotional devastation surrounding it. Sarah is sobbing now, her whole body shaking. I grab a box of tissues and hand them to her, then sit down on the rolling stool, trying to figure out what my role is here. I'm a doctor. This is supposed to be a routine prenatal examination, but what's happening is so far beyond routine medicine that I feel completely unprepared. My training taught me how to diagnose complications of pregnancy, how to monitor fetal development, how to identify risk factors and manage medical conditions. But nothing prepared me for this, for being present at the moment a marriage potentially ends, for witnessing an accusation of infidelity in real time, for navigating the ethical complexity of a patient's personal crisis intersecting with medical care. Mrs. Martinez, I say gently after giving her a moment to compose herself, I know this is overwhelming, but I need to ask, is there any possibility that I cheated on him? She looks at me with red, furious eyes. No, absolutely not. I love my husband. We've been together since college, 15 years total, 8 years married. I have never ever been with anyone else since we got together. Not once, not even close. The certainty in her voice is compelling. I've been trained to maintain clinical objectivity, to not make judgments based on emotional presentations. But there's something about her shock, her immediate fury rather than defensiveness, that makes me believe her. Okay, I believe you. But we need to figure out what's going on here because medically, if your husband had a vasectomy 5 years ago and you're pregnant now, then either the vasectomy failed or he's lying about having one. She says it with certainty, her anger sharpening her thinking. Vasectomies can fail, I acknowledge. It's rare, but it happens. Usually within the first few months after the procedure when the remaining sperm in the vas deferens haven't been fully cleared. But occasionally later if the vas deferens, the tubes that were cut, somehow reconnect spontaneously. So we need to test him, prove whether he's actually sterile or not. That would be the logical next step, a semen analysis to check for sperm. If there are no sperm present, the vasectomy is still effective. If there are sperm, it either failed or he never had one to begin with. Sarah nods, wiping her eyes, trying to compose herself. But her hands are still shaking, and I can see the effort it's taking for her to maintain any semblance of control. Mrs. Martinez, before you leave, we need to think about the baby, regardless of what's happening with your marriage right now. I know, she interrupts. The baby needs care, prenatal vitamins, regular checkups. I'm not going to let my anger at Michael hurt this child. She places a protective hand on her belly. This baby didn't ask to be conceived into a marriage crisis. Whatever happens between Michael and me, I'm going to make sure this pregnancy is healthy. That's good to hear. But I'm also concerned about you. The stress you're under right now, that's not good for you or the baby. Do you have support? Family? Friends you can talk to? My sister. She lives about 20 minutes away. I can stay with her if I need to. That might be wise, at least for tonight. Give both of you some space to process before you try to have any more conversations. She nods, then looks at me with vulnerability breaking through her anger. Dr. Reyes, can I ask you something? Of course. In all your medical training, in all the cases you've seen, have you ever encountered anything like this? I think about lying, about offering reassuring platitudes, but she deserves honesty. No, I admit, I haven't. This is new territory for me too. Well, she says with a bitter laugh that sounds more like a sob, at least we can be confused together. She gathers her things slowly, moving like someone who's aged 10 years in the past 15 minutes. At the door, she pauses and turns back. He kept a secret from me for 5 years, she says quietly. A huge, life-altering secret about his fertility, about our future as a family. And when the consequences of that secret came to light, his first instinct was to accuse me of betrayal. What does that say about our marriage, Dr. Reyes? I don't have an answer. And even if I did, I'm not sure it would help. After Sarah leaves, I sit in the examination room for a long moment, trying to process what just happened. The ultrasound machine is still on, the screen now showing nothing but static patterns. The baby images have been saved to Sarah's file, but the joy that should have accompanied that first real glimpse of her child has been completely overshadowed by the crisis that erupted. I need to talk to Dr. Huang. I need guidance on how to handle this situation, both medically and ethically, because while my primary responsibility is to Sarah and her pregnancy, there are ripple effects here that I'm not sure how to navigate. I find Dr. Huang in her office, reviewing lab results and eating what looks like a very sad desk lunch, a wilted salad and a yogurt that's probably been in the break room fridge for too long. Dr. Huang, I need to tell you about a case. It's complicated. She looks up from her computer, reading something in my expression that makes her set down her fork immediately. Complicated how? I explain the entire situation. The routine ultrasound that should have been joyful. Michael's revelation about the vasectomy, his accusation of infidelity, Sarah's adamant denial, the marriage crisis unfolding in real time in my examination room. Dr. Huang listens without interrupting, her expression growing more concerned as I talk. When I finish, she's quiet for a long moment, processing. Okay, she finally says. First question, medically, what are the possibilities here? Either the vasectomy failed and Michael is the biological father, or it didn't fail and someone else is the father, or Michael never actually had a vasectomy and is lying for reasons I can't begin to fathom. Good. Those are the three main possibilities. Now, what's your role as Sarah's physician in this situation? Provide good prenatal care regardless of the paternity situation? Yes, but more than that, Noah. Your role is to support your patient, Sarah, through whatever crisis she's facing while ensuring she and the baby receive appropriate medical care. You're not a marriage counselor. You're not a detective trying to determine the truth of her fidelity. You're not here to judge or assign blame. You're here to take care of a pregnant woman who's just had her world turned upside down. I nod, absorbing this. What about Michael? Do I have any obligation to him? Michael is not your patient. Sarah is. Your duty is to her and to the fetus she's carrying. If Michael wants to pursue semen analysis to confirm whether his vasectomy failed, he can do that through his own physician. But that's not your concern or responsibility. But what if, I hesitate, trying to articulate my discomfort. What if Sarah did cheat? What if she's lying and I'm supporting her in that lie? Dr. Huang leans back in her chair, giving me her full attention. Noah, that's not for you to determine. Your job is to provide medical care, not to be a moral arbiter of your patient's relationships. Even if Sarah had been unfaithful, and I'm not saying she was, she still deserves compassionate, non-judgmental medical care. Every patient does. I understand that intellectually, but emotionally, you want the truth. You want to know what really happened. That's natural. We're human beings, and we're wired to want narrative coherence, clear heroes and villains. But medicine doesn't work that way. People's lives are messy and complicated, and our job is to care for them in the midst of that mess, not to demand they clean it up before we'll treat them with respect. She pauses, making sure I'm listening. Here's what I want you to do. Give Sarah a few days to process everything. Then reach out, a phone call, not a text, and check in on her. Ask how she's doing emotionally and physically. Remind her about prenatal care. Offer to refer her to counseling if she wants support navigating this crisis. And document everything carefully in the medical record. Why document so carefully? Because this could potentially become a legal issue. If Michael decides he doesn't want to be involved with this pregnancy because he believes the child isn't his, there could be questions about insurance coverage, financial responsibility, parental rights. Document the facts objectively, without editorializing. Note that patient presented for routine ultrasound, that during the exam her husband disclosed previous vasectomy and questioned paternity, that patient denies infidelity, and that the pregnancy continues to be medically normal. It's good advice, clinical, professional, focused on my actual responsibilities rather than the dramatic human story that's unfolding. But as I return to my other duties for the afternoon, seeing patients with diabetes, hypertension, respiratory infections, I can't stop thinking about the look on Michael's face when he made his accusation. The absolute certainty, the devastation, the sense of betrayal, and I can't stop thinking about Sarah's shock and fury. The way she immediately pivoted from defending herself to questioning whether Michael was telling the truth about the vasectomy. The protective hand she placed on her belly, as if shielding the baby from the conflict. Someone is lying, or someone is wrong, or there's a medical explanation that will make sense of this impossible situation, and I have no idea which possibility is true. That night, I can't sleep. I lie in my small apartment staring at the ceiling, replaying the scene in my examination room over and over. Around 2 a.m., I give up on sleep and pull out my laptop to research vasectomy failures. The medical literature is clear. Vasectomy is one of the most effective forms of contraception, with a failure rate of less than 1%. Most failures occur in the first few months after the procedure, when viable sperm may still be present in the reproductive tract beyond the point of the vasectomy. These early failures are why men are advised to use backup contraception and get a semen analysis at 3 months post-procedure to confirm the vasectomy was successful. Late failures, occurring years after the procedure, are much rarer. They typically happen through one of 3 mechanisms. First, recanalization, where the cut ends of the vas deferens spontaneously reconnect, creating a new channel for sperm to travel. This is rare but documented, occurring in less than 1 in 1,000 cases. Second, incomplete vas deferens occlusion during the initial surgery, if the surgeon doesn't completely sever both vas deferens, or if there's anatomical variation that wasn't recognized. This is even rarer, but possible. Third, the presence of an accessory vas deferens, a congenital anatomical variation where a person has an extra pathway for sperm that wasn't cut during the vasectomy. This occurs in less than 1% of men. So medical literature supports the possibility that Michael could be the biological father despite his vasectomy. It's unlikely, but not impossible. But there's another possibility that keeps nagging at me. What if Michael never had a vasectomy at all? What if he's lying about the procedure for some reason? But why would he lie? What possible motivation would he have for falsely claiming to be sterile? Unless he wanted an excuse to accuse Sarah of infidelity. Unless there are deeper issues in their marriage that I'm not seeing. Unless this is about control or suspicion or some pathology in their relationship that preceded this pregnancy. But that feels like speculation beyond my role as a physician. Dr. Huang was right. My job is to care for Sarah and her pregnancy, not to investigate the truth of her marriage. Still, I can't shake the feeling that understanding what's really happening here matters. Not just for the medical management of the pregnancy, but for Sarah's well-being, for her ability to navigate whatever comes next. Around 3 a.m., I finally fall into restless sleep, dreaming of ultrasound images and accusatory voices and secrets that unravel lives. 3 days later, I get a call from Sarah's number. I'm in the middle of morning rounds, but I step out into the hallway to answer immediately. "Mrs. Martinez, how are you doing?" "Not great." Her voice sounds exhausted, hollow. "But I wanted to update you. Michael got a semen analysis done yesterday through his urologist. The results came back this morning." I wait, my heart pounding, aware that whatever she's about to tell me will either solve this mystery or deepen it. Azoospermia, that's what they called it. 0 sperm count. The urologist confirmed that Michael's vasectomy is intact and currently effective. He is definitely medically sterile. The bottom drops out of my stomach. Because if Michael is definitively sterile and Sarah is definitively pregnant, then either Sarah is lying about being faithful or something medically extraordinary is happening. "Mrs. Martinez, I need to ask you something and please don't be offended. Is there any possibility, any at all, that you could have been with someone else and not remembered? Medication that might have affected your memory? Alcohol to the point of blackout? Any situation where your memory of events could be incomplete?" "No." Her voice is firm, certain. "Dr. Reyes, I understand why you're asking. I know how this looks. But no, I don't drink to excess. Maybe 1 glass of wine with dinner occasionally. I don't take any medications that affect memory or consciousness. I have clear, continuous memory of my entire life for the past 5 years, and in that time, I have been with exactly one person sexually. My husband. Okay, I believe you. But Sarah, we have a medical impossibility here. You're 12 weeks pregnant. Your husband is sterile. Those 2 facts can't both be true unless what?" And then it hits me. A possibility I hadn't fully considered. A scenario that would explain everything. "Mrs. Martinez, did you and your husband ever do any fertility treatments? In vitro fertilization? Intrauterine insemination? Anything like that during the 2 years you were trying to conceive?" "No, we talked about it. I actually wanted to start exploring that route about 6 months ago, but Michael kept saying we should keep trying naturally, that we didn't need medical intervention yet. Now I'm wondering if that was because he knew he was sterile and didn't want me to find out. Did you ever have any eggs frozen? Embryos created and stored?" "No, like I said, we never pursued any fertility treatments." Another possibility eliminated. I'm running through scenarios in my mind, trying to find a medical explanation that fits all the facts. What about sperm donation? Is there any possibility that Michael... Absolutely not. We never discussed that. And Dr. Reyes, if Michael had used donated sperm to get me pregnant, why would he now be accusing me of infidelity? That doesn't make any sense. She's right, it doesn't. "Mrs. Martinez, I think we need to do paternity testing. There are non-invasive prenatal paternity tests available now, They just require a blood sample from you and from the potential father. They analyze the baby's DNA that's circulating in your bloodstream and compare it to the father's DNA. You mean to prove it's not Michael's baby, or to prove that it is, which would mean the vasectomy failed despite the recent semen analysis showing no sperm. How is that possible? It's rare, but I've read case reports of vasectomy failure where the vas deferens reconnects temporarily, allowing sperm through during a brief window, then closes again. If conception happened during that window, the father would be sterile now but would have been fertile at the moment of conception. Sarah is quiet for a long moment, processing this. So you're saying Michael could be the father even though he's testing as completely sterile now? It's a possibility. A small one, but a possibility. The only way to know for certain is paternity testing. And if the test shows Michael is the father, then we'd know the vasectomy failed temporarily, and Michael would have to accept that his accusation was wrong. What if the test shows he's not the father? I don't want to answer that question because the implications are devastating, but she deserves honesty. Then we'd have to consider other explanations. But Mrs. Martinez, let me be clear. I'm not suggesting you were unfaithful. I believe you when you say you haven't been with anyone else. But if the paternity test rules out Michael, we'd need to explore other possibilities. Medical explanations, errors in the testing, anything that might account for this situation. Other medical explanations like what? I don't know yet, but I promise you, if the test says Michael isn't the father, I'm not going to just accept that you must have cheated. We'll keep investigating until we understand what's really happening. I can hear tears in her voice when she responds. Thank you, Dr. Reyes. Thank you for believing me when even I'm starting to doubt my own sanity. Don't doubt yourself. We're going to figure this out. After we hang up, I immediately start researching cases of pregnancy in men with documented azoospermia. The medical literature is sparse but fascinating. Most cases involve vasectomy failure through recanalization, but there are also rare case reports of something called surgical sperm retrieval, where sperm are extracted directly from the testicles of men who have no sperm in their semen, including men with successful vasectomies, but that requires a medical procedure. Sarah would have known if she'd undergone intrauterine insemination or IVF, unless someone did the procedure without her knowledge, but that's verging on medical thriller territory, not realistic medicine. I'm grasping at straws, trying to find an explanation that preserves both Michael's apparent sterility and Sarah's insistence on fidelity. The non-invasive prenatal paternity test requires blood samples from Sarah and from the alleged father. Sarah comes in 2 days later for her blood draw. She looks exhausted, dark circles under her eyes, her skin pale, her movements slow and careful like someone who's emotionally fragile and trying not to break. How are you holding up? I ask as the phlebotomist prepares her arm. I'm staying with my sister. I haven't talked to Michael except by text. He's certain the baby isn't his. He's already contacted a lawyer about divorce. I'm sorry. He won't do the paternity test. He says he doesn't need one to tell him what he already knows. He says the semen analysis is proof enough that the baby can't be his, and he's not going to participate in what he calls my elaborate charade. We can still do the test, I explain. If we have Michael's DNA from another source, like a cheek swab or even something from home that has his DNA on it, we can compare that to the baby's DNA. I brought his toothbrush. She pulls it out of her purse, sealed in a plastic bag. I felt like a criminal stealing it. But I need to know the truth, Dr. Reyes. I need proof. Even if Michael won't look at it, even if he's already decided I'm guilty, I need to know for myself. The desperation in her voice is heartbreaking. The phlebotomist draws Sarah's blood while I carefully document the toothbrush sample, noting the chain of custody and Sarah's consent for the testing. Everything needs to be meticulous, because if this ends up in a legal proceeding, the validity of the test will be scrutinized. The results will take 5 to 7 business days, I tell Sarah. I'll call you as soon as they come in. And then what? If it shows Michael is the father, will he believe it? Or will he accuse me of somehow faking the results? I don't know. But at least you'll have objective medical evidence. That has to count for something. She looks at me with eyes that have seen too much pain in too short a time. Dr. Reyes, can I tell you something? Something I haven't told anyone else? Of course. Part of me hopes the test shows he's not the father. I'm startled by this admission. What? Why? Because if the test shows he is the father, if we prove that his vasectomy failed and he accused me of infidelity for no reason, I'm not sure I can forgive him. Not just for the accusation, but for the speed of it. He didn't even consider the possibility that his vasectomy might have failed. He just immediately assumed the worst about me. And that tells me something about how he really sees me. about what he really thinks I'm capable of. She wipes away tears. But if the test shows he's not the father, if there's some impossible, inexplicable medical situation happening, at least I'd understand why he reacted the way he did. At least his accusation would make sense, even if it was wrong. Sarah, you shouldn't have to hope for an outcome that makes his mistrust reasonable. I know. But Dr. Reyes, I love my husband. Even after everything, even with all this pain, I love him. And I don't know how to stop loving someone just because they hurt you. The waiting is excruciating. For Sarah, who calls me twice during the 5 days, just to confirm that I haven't forgotten about her, that the results haven't come in early. For me, who finds myself distracted during other patient appointments, wondering about this case, checking my computer compulsively for lab results. For Michael, presumably, though I only know about his waiting secondhand through Sarah's reports. He's apparently moved into a hotel. He's hired a divorce attorney. He's told his family that Sarah had an affair. The narrative he's constructed is so complete, so certain, that I wonder how he'll react if the test proves him wrong. On day 5, around 3 p.m., the results arrive in my inbox. I stare at the computer screen, reading and rereading the report, my heart pounding. Probability of paternity, 99.999%. Michael Martinez is the biological father of Sarah's baby. Against all odds, despite a vasectomy 5 years ago, despite a recent semen analysis showing complete azoospermia, despite medical logic suggesting this should be impossible, Michael is definitively, unquestionably the father. I immediately call Sarah. She answers on the first ring. Mrs. Martinez, I have your results. And? Her voice is tense, scared. Michael is the father. 99.999% certainty. There is no doubt, medically, biologically, definitively. Michael is the father of your baby. Silence. Long, profound silence. For a moment, I think the call has dropped. Sarah? I'm here. Her voice is strange, controlled. I don't know whether to laugh or cry or scream. He's the father. After everything he accused me of. After making me doubt my own sanity. After destroying our marriage with his suspicion and mistrust. He's the father. Sarah, this is good news. It means I was telling the truth, yes. It means I wasn't losing my mind. But Dr. Reyes, it doesn't fix what he did. It doesn't undo the fact that when faced with something he couldn't immediately explain, his first instinct was to assume I betrayed him. It doesn't erase the last 2 weeks of hell he's put me through. What are you going to do? I don't know. I need to think. I need to process. Can you email me a copy of the results? Yes. Sarah, one more thing. We need to figure out how this happened. Medically, this shouldn't be possible. Michael needs to follow up with his urologist to investigate how he could be the father, despite documented azoospermia. I'll tell him, if he'll listen to me. After we hang up, I sit at my desk for a long time, staring at the paternity results. This should feel like a victory. We've solved the medical mystery, proven Sarah's fidelity, confirmed Michael's paternity, but it doesn't feel like a victory. It feels like the end of one crisis and the beginning of another. Because now Michael has to face the fact that he accused his wife of infidelity when she was innocent. He has to reconcile his certainty about her guilt with the objective medical evidence of her innocence. He has to live with the damage he's done to their marriage based on an assumption that was completely, devastatingly wrong. That evening, my phone rings. Unknown number. I answer. Dr. Reyes, this is Michael Martinez. My stomach clenches. I wasn't expecting to hear from him directly. Mr. Martinez, how can I help you? Sarah told me about the test results. His voice is strained, hollow, like someone who's been gutted. The baby is mine. Yes. Which means I accused my wife of cheating when she was completely innocent. I destroyed my marriage based on an assumption that was wrong. Mr. Martinez, I'm not a marriage counselor. I know, I'm not asking you to be. But I need to understand. Medically, how is this possible? I had a vasectomy. I got a semen analysis 2 weeks ago that showed 0 sperm. 0. How can I be the father? There are a few possibilities. The most likely is that your vasectomy failed, either temporarily or permanently. The vas deferens can sometimes reconnect spontaneously, allowing sperm through. Or the original surgery might not have been completely successful. But I have 0 sperm now. The urologist confirmed it. Right. Which suggests that if reconnection occurred, it was temporary. A brief window where sperm could get through, then the connection closed again. If conception happened during that window, you'd be the father, even though you're sterile now. A temporary reconnection. He sounds like he's trying to wrap his mind around this. How long of a window? It varies. Could be days, could be weeks, long enough for conception to occur, but then the connection closed and you're back to being sterile. So this whole thing, this nightmare, is because of a medical fluke? A random biological event that I had no way of knowing about? Essentially, yes. Though Mr. Martinez, you should follow up with your urologist. They may want to investigate further to understand exactly what happened. He's quiet for a long moment. Then, Dr. Reyes, I need to ask you something. When Sarah was in your office, when I accused her, did she seem guilty? Did anything about her behavior suggest she was lying? I choose my words carefully. Mr. Martinez, my role is to provide medical care, not to make judgments about your wife's behavior. But I will say this, Sarah was shocked by your accusation. Her immediate reaction was confusion, then fury, and in the 2 weeks since, she's been insistent about her innocence and proactive about pursuing the paternity test. That's not typically the behavior of someone who's guilty and trying to cover up infidelity. So you believed her. I believed she was telling her truth, and now we have medical evidence that confirms she was right. I was so certain. His voice breaks. The vasectomy, the semen analysis showing no sperm. It all pointed to the same conclusion. How could I be the father? It was impossible. So my brain filled in the only explanation that made sense. She must have been with someone else. Human brains do that. We create narratives that fit the facts as we understand them. But sometimes our understanding is incomplete. That's a generous way of saying I was wrong. That I accused my wife of something terrible based on incomplete information and jumped to the worst possible conclusion about her. I don't respond, because there's nothing I can say that will make this easier for him. Dr. Reyes, I've lost her. Sarah won't talk to me beyond brief texts. She's staying with her sister. She's hired a lawyer, and I don't blame her. I wouldn't forgive me either. Have you apologized? I've tried. I sent flowers. She returned them. I wrote a long letter explaining my thinking, taking responsibility. She didn't respond. I asked if we could go to couples counseling. She said she needs time to think, time to figure out if she can ever trust me again. Then give her that time, Mr. Martinez. This is a profound betrayal from her perspective. You didn't just accuse her of infidelity. You immediately assumed the worst about her character without even considering alternative explanations. That's going to take time to heal, if it heals at all. You think it won't heal? I think that's up to Sarah, and up to whether you can demonstrate that you've genuinely understood what you did wrong and why it was so damaging. After we hang up, I sit in the darkening evening light of my apartment, thinking about marriage and trust and how quickly certainty can destroy what years of love have built. 2 weeks after the paternity results come in, 4 months into Sarah's pregnancy, she comes to my office for her 16-week prenatal checkup. She's visibly pregnant now, her belly showing under her loose-fitting shirt. She comes alone. How are you feeling? I ask, starting with the easy question, the medical one. Physically, I mean. Physically fine. The morning sickness has completely resolved. I have more energy. The baby's been moving a little, which is strange, but kind of amazing. That's normal for this stage. You'll start feeling more definite movements over the next few weeks. I do the routine examination. Blood pressure, fundal height, fetal heart rate. Everything is medically perfect. The baby is thriving despite the emotional chaos surrounding the pregnancy. And emotionally, I ask when the medical portion is complete, how are you doing with everything? She's quiet for a moment, considering her answer. That's more complicated. Michael has been trying to reach out. He sent flowers. I sent them back. He wrote me a long letter apologizing and explaining his thinking. I read it but didn't respond. He's asked multiple times if we can go to couples counseling together. Have you considered it? I have. But Dr. Reyes, here's what I keep getting stuck on. I understand why he was confused when he found out I was pregnant. I really do. From his perspective, he'd had a vasectomy, so pregnancy should have been impossible. I get why his brain went to infidelity as an explanation. But the speed of it, the certainty. He didn't ask questions. He didn't say, this is strange. Let's figure out what's going on together. He immediately accused me in front of you, made me feel like a criminal, and then spent 2 weeks treating me like I'd betrayed him. What does that tell me about how he really sees me? What do you think it tells you? That on some level, even before this, he didn't completely trust me. That when faced with something unexplainable, his default assumption was that I was lying, not that there might be a medical explanation. And that scares me, Dr. Reyes. Because if he can jump to that conclusion so quickly about something this significant, what else might he assume about me in the future? It's a legitimate question. Trust, once broken, is difficult to rebuild. And Michael's assumption of Sarah's guilt, immediate and absolute, does suggest either a pre-existing insecurity or some deeper issue in their relationship. Have you told him that? I've tried. He says he was in shock, that he wasn't thinking clearly, that he deeply regrets his reaction. He says it was the medical evidence, the vasectomy, the zero sperm count, that made him so certain, not any underlying mistrust of me specifically. Do you believe that? I don't know. Part of me wants to believe it. Part of me loves him and wants to forgive him and move forward. But another part of me, a part that's probably smarter and more self-protective, that part keeps asking, what happens the next time something confusing or unexplainable occurs in our marriage? Will he immediately jump to the worst conclusion about me? Can I live with that constant threat of accusation hanging over our relationship? She places a protective hand on her belly, a gesture that's become automatic. And there's something else. Even if I could forgive him for the accusation, I'm not sure I can forgive him for the original secret. 5 years, Dr. Reyes. He kept a vasectomy secret from me for 5 years. He made a permanent reproductive decision without involving me, then hid it. What does that say about how he views our partnership? Have you asked him why he kept it secret? He says he thought he was protecting me. I was struggling so much with postpartum depression after Emma was born, and he didn't want to add to my burden by making me worry about birth control or future pregnancies. He thought he was being helpful by just handling it himself. But you didn't experience it as helpful. No, I experienced it as controlling, as him making a major decision that affected both of us without giving me a voice. And now I keep wondering, what other decisions has he made without telling me? What other secrets might he be keeping? There's a knock on my office door. Dr. Huang pokes her head in. Noah, sorry to interrupt. Can I see you for a moment? I excuse myself and step into the hallway. Dr. Huang looks concerned. I just got a call from Michael Martinez's urologist, Dr. Patterson. He asked if I could help coordinate some additional information about the case because he's trying to figure out how Michael could be the father despite documented azoospermia. What did he find? Apparently, Michael's original vasectomy was performed by a surgeon who has since retired. Dr. Patterson requested the operative notes from 5 years ago, and he found something interesting. There's a note in the surgical record about difficult anatomy and challenging visualization, but no specific mention of any anatomical variations or complications. What does that mean? Dr. Patterson thinks the original surgeon might have encountered an anatomical variation, possibly an accessory vas deferens or unusual anatomy, and either didn't recognize it or didn't properly address it during the surgery, which would mean Michael's vasectomy was incomplete from the beginning. My mind is racing. So Michael's been fertile this entire time, despite believing he was sterile? Possibly. Dr. Patterson wants to do additional testing, including a testicular biopsy to look for sperm production, but preliminary imaging suggests that might be the case. If so, it would explain how Sarah got pregnant and why Michael's current semen analysis shows azoospermia despite proven paternity. How can he have azoospermia but still be fertile? If there's an accessory vas deferens that wasn't cut during the vasectomy, sperm could still be produced in the testicles but not reach the semen during ejaculation. But under certain conditions, specific timing, physiology, position, sperm might occasionally get through. It's rare but documented in medical literature. This changes everything. Not just the medical explanation, but the entire narrative of what happened between Sarah and Michael. I return to my office where Sarah is waiting anxiously. Is everything okay? She asks. Sarah, I just got some information from Michael's urologist. They've been investigating how Michael could be the father despite his vasectomy, and they think they've found an answer. I explain what Dr. Huang told me. The difficult anatomy noted in the original surgery, the possibility of an accessory vas deferens, the theory that Michael's vasectomy was never fully successful. So Michael has been fertile all along? Sarah asks, trying to understand. For all 5 years? Potentially, yes, but with very low sperm count reaching the semen, which is why it took 2 years for you to conceive and why his recent semen analysis showed no sperm. The sperm that are there are inconsistent and hard to detect. But he really did have a vasectomy? He wasn't lying about that? No, he wasn't lying. The surgery happened. It just wasn't completely successful due to anatomical variation that the surgeon either didn't recognize or couldn't properly address.
Sarah is quiet, processing this information. Then, unexpectedly, she starts crying. Sarah? What's wrong? I'm relieved, she says through tears. I'm so relieved, because this means he was telling the truth about the vasectomy. He really did believe he was sterile. His accusation was based on medical facts as he understood them, not on some paranoid assumption or desire to control me. So you're forgiving him. I don't know yet, but at least now I understand.
He wasn't jumping to conclusions about my character. He was making a logical inference based on medical information that turned out to be incomplete. That's different from him fundamentally not trusting me. She wipes her eyes, composing herself. Dr. Reyes, can I ask you something? Does Michael know about this yet? About the incomplete vasectomy? I'm not sure. His urologist would need to discuss it with him directly. Can you call him? Can you tell him? Because I think I'm ready to talk to him. Really talk. Not through lawyers or brief texts, but I need him to understand the full picture first. I need him to know that this wasn't his fault or my fault. It was just a medical fluke that neither of us could have predicted. That evening I call Michael and explain the urologist's findings. He's silent for a long time after I finish. So, I've been fertile all along, he finally says. The vasectomy never actually worked. All these years, I thought I was protecting us from unplanned pregnancy, but it was all based on a surgical error I never knew about. It sounds like the anatomy was unusually difficult, and the original surgeon did the best they could with what they could visualize. It's not anyone's fault. It's just unfortunate anatomy combined with an incomplete procedure. And Sarah, Jesus, what I put her through. Based on information that was wrong. Based on a certainty that was completely misplaced. Michael, Sarah knows about the anatomical findings now, and she asked me to call you. She wants to talk. Really talk. Not just exchange texts through lawyers. She does? Hope floods his voice. Yes. But, Michael, I need you to understand something. Knowing the medical explanation doesn't erase the hurt you caused. Sarah still has legitimate anger about the way you handled this situation. The medical facts explain why you were confused, but they don't excuse the speed with which you accused her or the way you treated her afterward. I know, and I'll spend the rest of my life apologizing if that's what it takes. Maybe start by just listening. Let Sarah tell you how this affected her. Don't defend or explain, just hear her pain and acknowledge it. I can do that. One more thing. The secret you kept about the vasectomy, that's a separate issue from the accusation of infidelity. Sarah feels betrayed that you made a permanent reproductive decision without involving her. That's something you'll need to address in whatever conversations you have moving forward. I understand. Thank you, Dr. Reyes, for everything. For believing Sarah when I didn't. For investigating instead of just accepting the obvious explanation. For treating this as a medical mystery instead of a moral failing. After we hang up, I sit in my apartment thinking about how close this marriage came to ending. How a surgical error from 5 years ago nearly destroyed a family. How certainty, absolute unwavering certainty, can be one of the most dangerous things in medicine and in relationships. 1 week later, Sarah comes to my office with news. Michael and I are trying couples counseling, she says. She looks lighter somehow, less burdened. We're not living together yet, and I'm not making any promises about the future, but we're at least talking. That's good to hear. The therapist has been really helpful. She's helping us understand that we both made mistakes. Michael with the secret vasectomy and the accusation, me with not being more direct about my changing feelings about having more children. We're learning to communicate better. What changed your mind? About being willing to try counseling with him? Understanding the full medical picture helped. Knowing that his vasectomy really was incomplete, that he wasn't lying about that, it made his confusion more understandable. He wasn't paranoid or controlling, he was just working with incomplete medical information. She pauses. But more than that, I think what changed was seeing how he's handled the aftermath. He's not defensive. He's not making excuses. He's taking full responsibility for the accusation and for the secret he kept. He's doing the work in therapy. He's showing me, through consistent actions over time, that he understands what he did wrong and why it was harmful. Those are good signs. There's something else. Michael followed up with his urologist, Dr. Patterson. They did additional testing and confirmed that he has an accessory vas deferens that wasn't cut during the original vasectomy. Dr. Patterson apologized on behalf of the original surgeon and the practice. They've updated their protocols to check for anatomical variations more carefully before and after vasectomies. So at least something good came from this situation. Better medical care for future patients. Exactly. And you know what Michael said? He said he's not going to sue for malpractice. He says this baby, our baby, is the best thing that could have come from a surgical error. And I think he really means it. How do you feel about that? Complicated. I'm glad there's a medical explanation. I'm glad we understand what happened. But I'm also angry that an anatomical variation and surgical limitation caused so much pain in our marriage. If that surgeon had been more thorough, Or if Michael had followed up with post-vasectomy sperm testing like he was supposed to, we could have avoided this entire crisis. But you wouldn't have this baby. Her hand goes to her belly, an automatic gesture of protection and connection. Exactly, which is the most confusing part of all of this. This baby, this pregnancy that nearly destroyed my marriage, is also the thing that might save it. How so? Because working through this crisis has forced Michael and me to confront issues in our relationship we've been avoiding for years. Trust issues, communication problems, different expectations about partnership and decision-making. We're actually talking about these things now instead of pretending they don't exist. So, in a strange way, the crisis became an opportunity? I guess so. I'm not saying I'm grateful for the pain, I'm not, but I'm grateful for what we're learning. And I'm grateful that you believed me, Dr. Reyes. When Michael was certain I'd cheated, and even I was starting to doubt my own memory, you approached the situation with scientific curiosity instead of judgment. That mattered more than you know. 2 months later, 6 months into her pregnancy, Sarah and Michael come to the anatomy scan together. It's the first time I've seen them in the same room since that devastating ultrasound at 12 weeks. They're holding hands. The relationship between them is still tentative, still healing, but there's something there. A connection, a commitment to trying, a shared purpose in the baby they're about to meet on the ultrasound screen. The tech performs the scan, checking all the anatomical structures, measuring growth, assessing development. Everything is perfect. And when the tech asks if they want to know the sex, they both say yes simultaneously, then laugh at the synchronicity. "It's a boy," the tech announces. Sarah squeezes Michael's hand, tears in her eyes. Michael is crying openly, unashamed. "A son," he says quietly. "We're having a son." After the appointment, they stop by my office to thank me. "Dr. Reyes, we wanted you to know that we're moving back in together next week," Sarah says. "We've made a lot of progress in therapy, and we both feel ready to try living as a family again." "That's wonderful. I'm happy for you both." Michael speaks up, his voice emotional. "I need to thank you for how you handled this situation. You never made me feel judged for my reaction, even though I deserved judgment. And you gave Sarah the support she needed when I wasn't capable of providing it. I was just doing my job." "You were doing more than your job," Sarah says. "You were being a thoughtful, compassionate physician in a situation where a lot of doctors might have just stepped back and said, 'Not my problem.' You believed me when I needed someone to believe me. And you pursued the truth instead of accepting the easy explanation." "We've also been talking to Dr. Patterson's practice," Michael adds. "Not to sue, but to help them learn from what happened. They're implementing new protocols for checking anatomical variations during vasectomies and for emphasizing the importance of post-procedure semen analysis. Hopefully, other couples won't go through what we did." "So something good came from your crisis." "Several good things," Sarah says, placing a hand on her belly. "A baby we didn't plan but now can't imagine life without. A marriage that's stronger because we've been forced to address its weaknesses. Better medical protocols that might prevent future complications. And a deeper understanding of each other and what we need from our partnership." Michael looks at his wife with obvious love and gratitude. "We almost lost each other over suspicion and secrets, but we found our way back through honesty and hard work. That's not nothing." As they're leaving, Sarah turns back one more time. "Dr. Reyes, we've decided on a name for the baby, Noah. We're naming him Noah, after you. Because you helped us find our way through an impossible situation, and you never gave up on finding the truth." I'm speechless, honored, humbled. "You don't have to do that," I managed to say. "We want to," Michael says firmly. "Every time we say our son's name, we'll remember the lesson we learned. That truth matters, that assumptions can be dangerous, and that sometimes the most important thing we can do is believe people when they tell us who they are." Sarah delivers Noah Michael Martinez at 39 weeks and 2 days. I'm not present for the delivery. She's seeing an obstetrician for her ongoing care, but she sends me a photo an hour after the birth. Sarah holding the baby, looking exhausted and radiant with Michael beside her, his arm around her shoulders, both of them smiling at the infant in her arms. The text message reads, "Meet Noah Michael Martinez, 8 pounds, 5 ounces. Perfect in every way. Thank you for helping us get here. Thank you for believing when belief was the hardest thing." I save the photo and the message, storing them in a folder on my phone labeled "Why I Do This." 3 weeks later, Sarah and Michael come to my office for a postpartum follow-up visit. It's not standard protocol. Sarah's obstetrician would normally handle this, but they specifically requested to see me one more time. "We wanted you to meet Noah in person. Sarah says, holding the sleeping infant. "And to give you this." She hands me an envelope. Inside is a card with a handwritten note. "Dear Dr. Reyes, words feel inadequate to express our gratitude. You saved our family, not through surgery or medication, but through belief, persistence, and the willingness to pursue truth, even when it seemed impossible. When we were drowning in suspicion and hurt, you threw us a lifeline of scientific inquiry. When accusation threatened to destroy our marriage, you offered the radical gift of believing in both of us, believing Michael's medical certainty and Sarah's lived truth, then working to reconcile them. We've learned so much from this experience, about the dangers of absolute certainty, about the importance of considering alternative explanations before jumping to conclusions, about how love without trust is just fear wearing a mask, about how secrets, even well-intentioned ones, can poison relationships. Most importantly, we've learned that medicine is more than treating disease. It's about seeing whole people living complicated lives and caring for them with curiosity and compassion, even when, especially when, their stories don't make immediate sense. Thank you for being that kind of doctor. The world needs more physicians like you. With eternal gratitude and love, Sarah, Michael, and baby Noah." I keep that card on my desk through the rest of residency, through fellowship, into my first attending position. It sits beside other meaningful notes from patients, forming a collection of reminders about why I chose medicine, why I endure the exhaustion and stress and emotional weight. Years later, when I'm teaching medical students about ethics and patient care, I often tell them about Sarah and Michael, about the ultrasound that revealed not just a healthy fetus but a marriage in crisis, about the vasectomy that failed and the trust that nearly did too, about the complicated truth that emerged when we pursued it with scientific rigor instead of moral judgment. "What's the most important lesson from this case?" a student asks during one of these discussions. I think carefully before answering. The most important lesson is that our patients are whole people living complex lives. The medical issue that brings them to our office is often intertwined with relationships, emotions, histories, secrets, fears. Our job isn't to untangle all of that. We're not therapists or detectives, but our job is to see the whole person, to provide care that's both medically excellent and humanly compassionate, and to pursue truth without prejudgment. "But what if Sarah had been lying?" another student asks. "What if she really had cheated? Would you feel differently about how you handled it?" I've thought about that question many times, and my answer is no. My job was to provide good medical care and to support my patient through a crisis. Even if the paternity test had shown the baby wasn't Michael's, Sarah still would have deserved compassionate, non-judgmental care. The truth matters, but how we pursue truth matters just as much. "What happened to them?" a third student asks. "Are they still together?" I don't know. I lost touch with them after residency, but I hope they are. I hope they took the lessons from that crisis and built a stronger marriage. I hope little Noah grows up in a home where truth and trust are valued. I hope they remember that the pregnancy that nearly destroyed their family became the catalyst for healing. And what about the vasectomy? Did Michael ever get it properly completed? I don't know that either, but I hope they made that decision together this time. I hope they learned that major reproductive decisions need to be shared, not unilateral. I hope they both understand now that secrets in marriage, even well-meaning secrets, create distance that can become unbridgeable. Because that's what this case taught me, that medicine exists at the intersection of biology and humanity, that objective facts must be pursued but always understood within human context, that our role as physicians is to heal not just bodies, but to support people through the moments when their lives become unrecognizable. Sarah and Michael taught me that in a small examination room, over the course of a complicated pregnancy, through a marriage crisis that could have ended in divorce but instead became a crucible for growth. They taught me that sometimes the most important diagnostic tool we have isn't a lab test or an imaging study, it's belief, believing our patients when they tell us their truth, even when that truth seems impossible. Believing in the possibility of medical explanation for situations that appear inexplicable. Believing that people can change and grow and forgive and rebuild. And they taught me that the moment when someone smiles at an ultrasound, then hears words that shatter their world, that moment doesn't have to be the end of the story. Sometimes it's just the beginning of truth-seeking, of understanding, of hard conversations and harder healing. Sometimes the crisis that threatens to destroy everything becomes the foundation for building something stronger. That's what I learned from the pregnancy that should have been impossible, the accusation that should have ended a marriage, and the family that found a way through the impossible to reach the other side together. And I carry those lessons with me every day. In every difficult conversation, in every moment of patient confusion or family conflict, in every situation where belief matters as much as biology. Because sometimes, the most important thing a doctor can do is simply this: believe your patient, pursue the truth, and trust that understanding will emerge if you're patient enough and curious enough and compassionate enough to keep searching. That's what Sarah needed when Michael accused her of infidelity. That's what Michael needed when he couldn't reconcile his sterility with his wife's pregnancy. That's what medicine at its best offers. Not just answers, but the process of finding them together with respect and rigor and a fundamental belief that truth, however complicated, is better than the alternatives of assumption, accusation, and abandonment. That's what they taught me, and I'll never forget.